Hi, welcome to Sidewalk Talk. I'm Steve Fortunato, founder of Shovel the Sidewalk. We're a marketing firm in Buffalo, New York. We help small businesses build their brands. We create their advertising, and we're big believers in storytelling. That's authentic storytelling. That's why we have this podcast, so we can share stories. And in these certain times, we're connecting with people even more so because people need to be connected in this difficult time, and we want to not only share stories, but help share tips, things that can help us here in Western New York. And my guest now is Dr. Jenna Calabrese from Body Dynamics. She's the owner. She is a physical therapist and a good one at that, coming to us from her home. Hi, Jenna. How are you?
Great. How are you doing, Steve? Thanks for having me back.
Of course. Yeah, you're a second timer here.
Second timer, and it's a much different, story this day with us all being inside and doing what we can to socially isolate.
We'll start with the bad. I mean, you're in a business where, especially you believe in you utilize manual therapy. It's got to be tough on business right now. What are you doing?
Well, it is tough on business, without a doubt. My physical therapy practice is all manual based. I'm a concierge physical therapist, and so I either go to people's homes and I'm one-on-one with people, or people come to my house. The one positive is that I don't see a lot of people, so I'm not a huge risk. So in some ways, people are actually still comfortable to see me with the appropriate, safety measures in place, versus a large outpatient facility, which, has a lot more risk. But, virtually most of my business is shut down because, people just, feel like they can do some home exercises, which I give them an online database to do their home exercises. And they're just going to kind of take this time to do their exercises independently. And then once, we're all at less risk, then introduce me into their home or come into my home again.
Well, last time we talked, you and I were in person. Obviously, we've adjusted. We're doing our part and what we're supposed to do, and in keeping in line, trying to stop the spread of this virus. So, are there things that you can do virtually? I mean, you can't do a manual therapy virtually, obviously, but
right.
Are there things that you can help people with, like this, by using Zoom?
What their issue is, or what their problem is, you can have, a virtual session and, watch them go through a range of motion and try to give them some exercises to, maybe help with mobility or help with posture, body awareness. I mean, right now is the time that our workstations are turned upside down. Our lives are turned upside down. We're not moving the same. We're not having the same patterns every single day. So, we really have to be focused on, kind of maintaining good posture and, thinking about our mechanics and our positioning and our workstation so that, people, as they're trying to adapt and work at home, they don't get themselves injured, and they, take frequent breaks and, really kind of look at some, postural things as they try to make a makeshift office at home.
Well, so you're saying, okay, so how do they know if it's appropriate? Say there's people out there and they've never gone to any physical therapy. They've never had to meet with you or anybody else. Are there things they should be looking out for so that they don't get themselves in a bad situation?
I think right now is the time to, first of all, I think it's amazing that there's been in the fitness community that everyone's getting online and doing virtual classes. But, for the general public, they need to, if now's not the time to start something new, now is the time to, do something consistently and, do something very carefully. So, you're not going to decide, if you've never been a runner before, to go out and try to hit the bike path because that's the only thing you can do, and start training for a marathon. I think it's great that people are outside and trying to be active, but be cautious and do something in very small increments so that you can keep yourself healthy and you can keep yourself injury-free as you're trying to, adapt your schedule and, maybe move a little bit differently throughout the day.
So if I'm hearing you right, what you're saying is, obviously, we need exercise when there's a pandemic and when there isn't a pandemic, right?
Right.
So we always need exercise. But so you're trying to think ahead. So maybe some people now have more time than they had previously, and they're saying, I'm going to use this time to finally do what I needed to do and get in shape.
Right.
And what you're worried about is
Being too
maybe a
aggressive.
neophyte's going to get themselves in a little bit of trouble, and then they're going to need your help, and it's going to have to wait.
Exactly. Exactly. So, I'm not, disencouraging movement, but I'm just saying, proceed with caution. So if you're, starting a walking program, walk, don't run yet. If you want to introduce running, run for 20 seconds, jog for 20 seconds, and then go back to a walk. Slowly increase your activity. And also, if you're, trying to increase your activity, only do one thing for a few days, see how your body tolerates it, and then introduce something else. So that, if you are, a little bit sore or, something's bothering you, you can try to kind of figure out what caused what. So, if you're, wanting to get out there and get on the bike path, and you're also, been really looking forward to starting yoga, do the bike path for the next week. And say, gosh, I feel pretty good. Okay, well, now I'm going to introduce some, gentle yoga and, try that. Don't do multiple modalities of exercise and throw it all in, and try, a CrossFit routine or a yoga or, do one thing at a time and make sure you're tolerating it before you experiment with something else in this time that you don't have, you have more online resources rather than, kind of professional face-to-face resources.
So that's a tough one. Someone's knee hurts. What should they do right now? What can they do?
I mean, the best thing if you're having any acute pain is, rest and ice. You're going to want to ice for the first 48 hours, and rest it. And then see how much it calms down, and then, assess it from there, and see if you need any interventions or, maybe try to talk to someone virtually to see, if they can diagnose anything. But the biggest thing if you're having any acute pain is simply rest and ice, and if you take any, over-the-counter medications as indicated.
So after a couple of days, maybe the problem got a little bit worse. If this was pre-pandemic, that can just give you a call. You can obviously check them out. This is not pre-pandemic. We're in the middle of it. They can't just let it go for a couple of months, right?
Right.
So are you suggesting whether they call their primary or they call someone like yourself and see if they could have a video conference? And you can't manually manipulate, but you could probably look at it, right?
Right.
No?
Yep, you can. So, talk to your primary care, call an orthopedic, urgent care. I'm sure they're doing a lot of phone conferencing right now, call a physical therapist if you have a relationship with a physical therapist. And we can walk you kind of through some, general questions, is it locking? Is it giving way? Does it buckle? What aggravates it? What calms it down? And through that subjective conversation, you can get an idea of maybe some potential injuries that you're thinking about. I had a patient before the pandemic. She was a former patient that I treated her for something else, and she called me and she said that her knee locked. Okay, it locked overnight. And she could not bend it. And so we wound up FaceTiming, and I showed her husband how to do a technique to try to unlock the knee. Unfortunately, it wasn't successful. She did go to a physician the next day. He gave her some injections so that she could kind of relax and have it calm down. And the nice thing is she's like, he did the exact same technique that you tried to have my husband attempt. And she goes, and it worked. My knees unlocked. So, I think that is, something that, it was good because she then had confidence in me as a physical therapist, that I was giving her the right information. It was just too acutely painful. So she did have to go and see a physician.
So we're talking with Dr. Jenna Calabrese from Body Dynamics. She's a physical therapist, and has given us some great tips so far. Is there any are there any kind of, I guess you're right. We're in different work sites now. We're mobile. We're not, maybe our workplace was set up perfectly so that our shoulders are back and all that stuff. And I get it. And we had a clock going. It was every 45 minutes, get up and walk, or if you're standing, don't stand the whole time, don't walk the whole time.
Right.
Are there certain exercises that maybe simple things that people could do at home that could help them get through, maybe because their posture is it's a different workplace, so they might go into some bad habits, I guess is my point.
Right. I think the biggest thing is, symmetry when you're sitting. Really make sure you're trying to sit on both butt cheeks and put a towel roll behind your back so you can have your natural lordosis and, have you weight bearing through both hips evenly. And then obviously I think, even if we're not doing work, because we don't have a lot to do, we're probably on our phones more. So we're probably looking down at that screen more. So probably the best thing would be to do a chin retraction. So you're gently going to pull your chin straight back, look straight up, and then bring it forward. Make a little double chin, look straight up, and bring it forward. Also, if you're seated or standing, you can just simply squeeze, bring those shoulder blades back and together, and then relax.
What does that do?
So that's just going to open up the chest. It's going to get your scapular muscles, which are some of our main postural muscles, to engage and kind of get us out of this forward head, tight pecs, posture. Also going to a doorway and gently leaning in to stretch out that pec. So this retraction exercise is an exercise to get our muscles to fire. When you're putting your arms on the doorway and gently leaning in, you're stretching out those pec muscles to help with that posture.
Maybe it's also about being aware. Like, I thought that's a great point. We're probably doing this a lot more now, so we have to be more aware of what we're doing to ourselves. And that I was talking to Dr. Frank O'Day. He's a TMJ specialist, and asking him for some advice. Like, there's a lot of stress going on right now, so there's probably people, a lot of headaches, a lot of TMJ don't even know about.
Yeah.
And one tip he said was just be aware during the day. Don't let your teeth touch. They shouldn't be touching. If they're touching, you're probably going to end up with some problems.
Right.
So great tip. So it's just, I think kind of what you're talking about is just be aware that you're doing a lot of this and try not to do that, right? Just yeah.
Right. And just know that it's a different time, and your body is gonna be acting differently. We're not on the same sleep schedule, even though people have been saying, keep with the same schedule, wake up at the same time. It's very hard with our kids at home and they're having a different schedule. Try to maintain as much as you can, but also know that life is just different. And, every day you're going to wake up and you're going to assess how you feel physically, how you feel emotionally, and, try to do one thing to make yourself feel better, whether it's a stretch or, getting out for a walk. But like I said, don't go from 0 to 100 at this time. Take baby steps to keep your health and wellness in check.
So Jenna, one thing, you're always so positive, and I think positivity is a good thing, especially when there's a pandemic. We're going through something that no one on earth has ever gone through, right? None of us, we haven't gone through any of this. So we'll wrap it up here. Can you give me give us something, give us a Jenna, give us some positivity about what's going to happen? Because I don't know when, but I know we're going to get back to normal. It might be a new normal, but we're going to get back to normal. What do you say?
I think we are going to get back to normal. And I truly believe when people are saying that, we have been so busy, with our lives. And this has really taught us how to slow down and have game night again. I mean, I ordered this and it came on, and online, and, we sit down at the table and have meals together. That went out the window. I mean, we never took the time. We never said we had the time, and now we're kind of learning that there's different ways to do things. And there's a lot of creativity that's coming out of this, which is really cool. There's a lot of, creativity, and there's a lot of realization that, family time and some downtime, can be a good thing. Obviously, not in every situation, but there are some things that we're learning just about, taking a deep breath, slowing down a little bit, and giving ourselves a break, and not doing anything too hard, too fast. Just take it one day at a time.
Yeah, I agree. When we get back to the new normal, whatever that is, I think we're going to live life a little bit differently after
Yeah.
this. I think
I
there's
do.
gonna be
I
a
do
lot.
too. Yeah.
Yeah.
There won't be immediate urgency that we need anything.
Right.
That we've all, lived on very little.
Yeah, I think it's going to be, I mean, for the good. It's obviously not for the good right now, especially for those that are vulnerable, and those that are hurting, and those that are losing their lives and their loved ones. It's not good. But when things get back, I think we always hear this. Everything gets put into perspective after a tragedy. I think things are in perspective right now. We're learning on the go, and we're learning quickly. So.
Yes, I agree.
All right. Well, Dr. Jenna Calabrese, Body Dynamics. You have a Facebook page, right?
Yep, Facebook page. I have a lot of tips online, a lot of postural things, some more exercises for people to do, some things in terms of bad habits to stay away from when we are sitting a little bit more these days. So check out my Facebook page. I'll be putting out more content daily.
Are we looking for Body Dynamics or Jenna Calabrese, your Facebook page?
Actually, if you look up Jenna Calabrese, Body Dynamics is underneath there. So it's all kind of within the same.
Calabrese, C-A, spell that for us.
C-A-L-A-B as in boy, R-E-S-E.
Okay, Jenna Calabrese, check it out. A lot of tips, very knowledgeable. I appreciate your time, your knowledge, and your willingness to help out the community with your advice and your expertise.
Thanks, Steve. I appreciate you helping me stay in touch with everyone.
You bet. Jenna Calabrese, Body Dynamics. You can download all of our podcasts. You could, on whatever your platform of choosing, they're all there for you. But you can also watch them. If you go to our website, we have all of our podcasts from the past. If you have a story that you think needs to be shared, especially some kind of inspirational story or someone there's a form we have on our website that you can complete. And we will get back to you. Look, we're a small marketing company. We can't create masks and ventilators. So we tried to figure out what we can do for the community, and that is do what we're good at, which is storytelling. We're going to help everyone tell their stories, and we're going to help each other get through this. Again, thanks to Dr. Jenna Calabrese. Appreciate your time. Appreciate your knowledge, Body Dynamics. Thanks again for everyone for listening, for watching, for participating. I'm Steve Fortunato, and this has been Sidewalk Talk.